So I just want to take a second and answer the question that Valerie Wise posted in the SFU Facebook group. And the first thing that I want to do is I want to thank Valerie for her question. I know sometimes it can be really tricky and makes us vulnerable to ask a question, especially like the question that Valerie asked. So Valerie, thank you so much for asking this question. The second thing I want to do is I just want to read the question that she posted so you can have some context. She said, "What do you do with a client who is very negative and hates being questioned and may also be in post-acute withdrawal from drugs and alcohol? Talking about her child seems to bring some joy, but that was only momentary. After her third session, she decided to disconnect and possibly get back to me in the future. I wished her the best and was quietly relieved. Is it possible that some people do not really want help?" So, Valerie, thank you so much for asking this question. I have a couple of things that I would like to say to this. First is one of the really important things in order for me to be able to answer the question is to know what are the client's best hopes, right? When you talk to the client and you ask her what her best hopes are, that would really help me to understand, does she want something from this process? The way that you phrased that question was, is it possible that some people don't want help? And I would say, potentially, yes, maybe she doesn't want help, but she does want something from coming to the session. And so really getting a clear desired outcome of what does she want, that's the first step. And I would say if she's able to articulate what her best hopes are, what her desired outcome is from this process, then she's no longer in the place where we can say she doesn't want something. Now, it's our job to help have a conversation that leads toward that desired outcome. Whether or not she wants help, I would say, is kind of beside the point. She wants her desired outcome, and we have the opportunity, and I would say the obligation, of asking questions that are about that desired outcome. So that's the first thing I would say is we have to get a desired outcome, and once she gives us a desired outcome, then it doesn't really matter if she wants help or not. We now begin to have a co-constructed conversation. The second thing that I would say is one of the things that we really have to do is begin to view her as someone amazing, to be in awe of her, right? And to think about somebody who's been struggling with substance abuse, and then to come in and to talk to somebody and to say, I think I want to change my life in some way. One of the things that I would say is to shift our perspective to be amazed that she's even made that step, because oftentimes people are using substances, whether drugs or alcohol, as their number one coping mechanism for other things that are going on in their lives. And in some sense, she's probably got to be coming into the session thinking, if I engage in this process, I might have to give up my number one coping mechanism, right? So of course there's going to be some ambivalence about that. Of course there's going to be some hesitation. Of course there's going to be reluctance to engage in this process, because what I know helps. You might tell me I need to give up. So that's one of the things I would say is to be in awe of her simply because she showed up. Now, that should influence our questions. And one of the things that I would want to say at this point is I would want to be really, really careful not to ask her a question I think a lot of solution-focused therapists might accidentally ask or inadvertently ask. And they'll ask a question that goes something like, so how did you get yourself here today? And that's a really well-meaning question, but I think one of the things that that does is that it makes something so significant seem a bit trivial in my mind. And so instead of asking that question of how did you get yourself here today, one of the things that I would want to do is, again, go back to that desired outcome. And I would want to ask a question about who in her life believes in her the most or trusts her enough that if they were also in the session with us, that they would have complete confidence that this client could actually achieve that desired outcome. And it sounds like her child may be one of those people. And so instead of saying, how did you get yourself here today? One of the things that I would want to ask is, what does your child know about you that lets you know that you're capable of doing great things? What does your child know about you, or what would your child tell me that would let me know that you're the kind of person who has already overcome very difficult things? And if your child saw you overcome this next challenge or difficulty, what would they do, or how would they let you know that they were pleased that you were overcoming these challenges and difficulties, right? So instead of trivializing just you showed up at the session, I want to make this really, really meaningful by bringing in the one person that she's mentioned, her child. And I want to get that child's perspective on the change that their mother is about to make. And what does the child know that lets them know that their mom is capable of making that change? When I can begin to see her through the eyes of her child, then I no longer worry that she's not going to be able to do it. I no longer give up hope, right? Kids are full of hope. And no matter how many times their parent relapses, no matter how many times they slip up, kids continue to hope that they will get better. And I, as a clinician, want to catch that hope and say, what does that child know about this mom that helps them to hold on to hope? And I want to have a conversation from that hopeful place. And if the mom says things like, I hate questions, I would say, I understand that you hate questions, but do you mind if I just ask you a few questions, knowing that you hate them, in order to be as helpful as possible, in order to help us understand what life might be like if you actually achieved that desired outcome? I think when we change the way that we view people, when we change the perspective that we have about what our job isn't to help her stay clean. Our job isn't to even become the kind of mom that she wants to become, unless that's her desired outcome. So I think one of the things that I would say is make sure that you keep a view of her that is consistent with the people who are amazed by her. And when you see her that way, I think it's no longer possible for us to say she doesn't want help, because I'm guessing that she doesn't want to let that child down. She would do anything to help that child. And when we can catch that same vision, we would do anything to help her, to help satisfy her child. So that's my answer. I would love to hear what you have to say, what you have to think about it, and your thoughts as well. So thanks very much.